Good morning. This is Dr. McDaniel at GYN Corner. I'm a board-certified obstetrician gynecologist in New York City, and I'm bringing to you all things health-related for women. Thank you for joining me at the corner today. And today I thought I would speak on chemical pregnancies because I've had a small rash of chemical pregnancies in the office. I feel like in the last month we've had about four, could be five patients with chemical pregnancies. So most patients aren't aware of what that is or what that means or what's the story with it. So I thought it'd be helpful to speak about that today. So let's see. I'll go back a bit. Historically, most women would not know that they were pregnant until they had missed a cycle by maybe sometimes one, but most of the time it was when they were missing that second menstrual cycle. This is before the time of apps and everyone being able to just click on their phone and see, everyone meaning usually the women under like 35, younger women, clicking on their apps and just putting in their cycle and seeing when their cycle's due. So women are much more aware of when their cycle is due and what their cycle patterns are. Years ago, when I pretty much the first couple decades, because this is 30 years now, so maybe the first 20 years or so of my career, when I'd ask a woman when the last menstrual cycle was, they would never know the exact date. They'd say, I don't know, maybe like 3 weeks ago, 4 weeks ago, and that was a standard. Like, very few women were keeping track of their cycles. They would have to write it out. This is pre-internet, apps, all of this, so they would have to be meticulous enough to write it out. And I can probably count on two hands the number of patients I'd seen sorry in the first 20 years of my career who knew exactly when their cycle was. And putting that, I guess I should say, combining that with the fact that 60% of pregnancies are unplanned, I feel like it's more like 70, 75, but statistically they say 60%. I'm going to say on the side, maybe 75% of pregnancies are unplanned. Only a small portion of women would say, oh yeah, the last menstrual cycle was February 23rd, and we've been trying for 3 months to get pregnant. So they would know because they're watching the clock. So like 70-75% of women weren't paying attention to their cycle. They weren't trying to get pregnant. So they miss the first cycle. It really just swoon, passes by. They don't even realize they missed that first cycle. And then by the time they're due for their second cycle, they're having more pregnancy symptoms, which really are the same symptoms as premenstrual symptoms. So breast tenderness, bloating, appetite change, sometimes acne, moody, irritable, emotional, fatigue, all of those, muscle aches, all of those are hormonal symptoms that a lot of women get before every single menstrual cycle. Now they're realizing, oh yeah, it feels like I've been pretty free for a while, no menstrual cycle. And they're getting all the symptoms. So it's like maybe week 6, week 7, and they're thinking, it feels like it's been a while since the last cycle, but of course they're not writing it down because the cycles just usually come. And then around the time they're due for that second cycle, they realize they're having all the symptoms. It's been maybe a week or two, there's no cycle. They either do a pregnancy test, a home pregnancy test, or they do one as soon as they come to the office. Now, of course, curiosity killed the cat. Most, like 90% of women are going to do that home test before they come in. Very rarely, less than 10% of the time, is someone say, yeah, I need to find out if I'm pregnant, and they haven't done a home test. They come in here to do it. So they do the home test, lo and behold, it's positive. Now they're trying to figure out when that last cycle was because they don't know how far along they are. So they come into the office and we do the home pregnancy test. Now, what's happened in the last month is the patient comes in, she says, I've done 3 pregnancy tests, they're all positive. And my response is always, okay, so now you're 3 times pregnant. You didn't need to do 3 pregnancy tests. If you do 1, that's good enough, because I'm sure if you give your husband, boyfriend, SO the second pregnancy test, it's going to be negative. So if the test is positive, it's really positive. You just don't get false positives anymore. Years and years and years ago, this is like 40, 50 years ago, there was a bit of cross-reactivity. You don't get that anymore. The tests are very sensitive, very specific. So realistically, most women, if they're pregnant, if they do that test a week before their menstrual cycles due, it'll be positive. So the test should be positive, ideally like a blood pregnancy test, which is the most sensitive. That should be positive around 2 weeks and 6 days. Yeah, 2 weeks and 6 days, maybe 2 weeks and 5, but really 2 weeks and 5, 2 weeks and 6, or 3 weeks pregnant. And the pregnancy dating starts from the first day of the last menstrual cycle. So a full week before the menstrual cycle's due. So historically, women wouldn't know till they're around 7, 8 weeks pregnant or so, because they weren't paying attention, they weren't focusing on it, they weren't trying to get pregnant. And just whenever I'd get someone pregnant, I wouldn't get them pregnant, but whenever I get someone who is pregnant in the office, whenever I get someone who's pregnant in the office, they were usually around, the earliest would be 6.5 weeks. They were usually like 7 to 8 weeks or so. 7 to 8 weeks was pretty much the average. And this was always the case, except for that small percentage of women who were wanting to get pregnant, keeping track and everything. But I started noticing around, I feel like it's been maybe, this is 2021, I feel like it's been maybe 7 years or so. I feel like for like the last 6 or 7 years, I'm getting more and more women coming to the office with a positive pregnancy test, and they're 3 weeks and 5 days, 4 weeks and 2 days. So as soon as their cycle's due, they have a lot of symptoms, or as soon as they miss the cycle, as soon as their app tells them it's late and they don't see it, they do the pregnancy test, it's positive, they come in. So it's kind of an interesting social phenomenon that now we're getting women coming in so early. Now, statistically, 25% of pregnancies will miscarry. And of that 25%, around 10% or so are under 7 weeks, 6.5 to 7 weeks. So they're very, very early miscarries. Now, 10 to 15%. Now, the catch is 20 years ago, or even like 15 years ago, most women would not have known they were pregnant because they wouldn't have done a pregnancy test under 6 weeks. They would have just figured, oh, my cycle was late this month. If they figured it out at all, they would have said, oh, I had a weird period. I feel like it came a few days late, or maybe it was a little bit heavier or a little bit longer than usual, but it came, so whatever. So up until around 10 to 15 years or so ago, I would just get, and then of course they would come into the office like a month or two afterwards. So they would come in after the cycle because it ended up being longer than they anticipated. Is everything okay? Or they would wait to see how the next cycle, or they'd come in for their annual and go, oh yeah, like in December I had a weird period. I think it was a few days late and it was a little bit longer. I had like PMS problems for a little bit longer than usual. Whatever case sera, that was months ago. These cycles are fine. I do a pregnancy test, it's negative, of course, everybody's happy. But once the apps came out and women started realizing, oh, my cycle was due on Tuesday and it's Wednesday. Now they're doing pregnancy tests and the pregnancy tests are coming up positive. So, and then of course, apparently, obviously I'm not buying pregnancy tests except the bulk ones we buy for the office. I'm not buying home pregnancy tests for myself. I didn't realize that most of the tests are coming in packs of 3. So I'm seeing all these patients and everyone's doing like 2 or 3 tests or 5 or 6 tests. I'm like, why are you doing so many pregnancy tests? Isn't that expensive? Like you're buying test after test after test, and they go, oh no, the test comes with 2 or it comes with 3 already. I don't know why these tests are coming with 2 or 3 at a time. That makes 0 sense. Like, if one is positive, they're all going to be positive because you're doing them like one after the other. You're doing them within like the same hour. So the hormones that are in the urine 40 minutes ago are still going to be in the urine now. So it doesn't make any sense to do so many tests unless they're packaging them separately, and maybe someone's having fertility issues, so they're doing a test that's negative, and then the next month they do another test that's negative, and then maybe the third month they do a test that's positive. So that's the only kind of rationale I could come up with why they're packing so many pregnancy tests in one pack, but whatever. So it's interesting that socially, because of the internet's changing everything. Sorry. Because of the internet, years ago, about 10 to 15% of these miscarriages would not have been known because women weren't doing pregnancy tests so early. They were just chalking it up to a wacky cycle. And also, the tests have gotten more specific and more sensitive. So they're able to do a pregnancy test at an earlier stage, and it's going to be positive if there's actually a pregnancy. I'm going to stop right there because I'm trying not to have these presentations go over 10 minutes, and this one's over 10 minutes. So I'm going to stop right there. This is part 1 of chemical pregnancy. What does that mean? Thank you for joining me at GYN Corner. Please check out the YouTube channel. We're on all of the platforms for podcasts if you enjoy listening to podcasts. And hit the like, subscribe, and follow buttons. That shows appreciation for what I'm doing, lets me know that you're voting for me to keep doing what I'm doing and in line with the presentations that I'm offering. If you have questions or if you have ideas for presentations, please post them below in the comment section. I'd appreciate that. You have a great rest of the day. Bye.